So the main topic of the session is on imaging and metabolism and genomics of tumors, and my particular subject is imaging of tumor habitats. And the main reason for, or the motivation for what I do, is that targeted therapies are failing, and we're very few durable responses to these targeted therapies. And the reason why targeted therapies fail is because tumors evolve and they have an ecology. And evolution occurs not only when you have genomic or phenotypic plasticity across the tumor, but they also have to have a selection pressure. So the microenvironment exerts a selection pressure. You can change the microenvironment by adding drugs, and what you're doing is you're just selecting for cells that have resistance to those drugs. The ecology aspect has more to do with how this all came about in the first place. So the ecology is a characterization of the physiological habitats that exist within tumors. And these are the microenvironmental selection pressures that cause the outgrowth of cells with different phenotypic properties. So in different regions of the tumor, you're going to have different cellular cancer cell and stromal cell phenotypes. And we know this just by examining tumors ex vivo, but more importantly, we can now image this. So we do multiparametric MR imaging, or you can do PET plus CT imaging to create. We use this information to create areas that have specific combinations of these imaging features. So importantly, some MR imaging. One of the techniques we use is called diffusion, and that's sensitive to cell density. T2 imaging is sensitive to the presence of metals, if you will. Okay. You can make it sensitive to the presence of metals, which can be either mitochondria or it could be macrophages will cause a change in T2. We look at contrast enhancement, so that's a measure of blood flow in the tumor. And these are all regional. So basically we can identify with these different combinations of imaging, we can define specific regions that have specific combinations of these factors, and these are we call habitats. And these habitats, we propose, within them have a specific phenotype of tumor cell. And we've seen this. The important other thing about imaging is you can capture the data longitudinally in a patient, so before they start therapy and during the course of therapy, and we can use these habitats to monitor the response. And so we're doing this with immune therapy, and we're doing it with chemotherapy, we're doing it with targeted therapy as well. There's always a limitation when you base your information on a biopsy, just because of the heterogeneity I talked about before. So you don't know where within the tumor you're capturing the biopsy. There was a very important paper in PNAS maybe 3 years ago where they sampled different regions of a brain tumor, and 8 out of the 9 biopsies gave one diagnosis, 1 out of the 9 gave a different diagnosis, and that diagnosis was actually the one that you would base therapy on. So there are challenges when you're limiting your information to a single point in time. If you can capture these data, though, on thousands of patients, then those issues tend to be washed out, and you can see some patterns emerge. But you need thousands of patients. It doesn't do much for the individual patient, though. So that's why I'm committed to imaging, because we see the whole tumor, and so we're not subject to sampling bias. And we can extract big data from images. Images are not pictures, images are data. And we can extract big data from images, and we can get images from thousands of patients because it's standard of care. Every patient gets imaged. So here are data that are routinely captured in the care and the diagnosis of cancer patients and we're not analyzing it to the extent that we need to. So this is a whole field called radiomics, which is conversion of images to mineable data that there are a number of people in the world that are doing. It's a matter of degree because this is done already. Images are part of the patient record. Oftentimes in the treatment of a patient, the oncologist will show the images to the patient to point out the tumor. But for the most part, oncologists are limited to just looking at the size of the tumor. And we know that that's misguided, that in many cases, the size of the tumor is not reflective of how well it's responding to therapy. No, I do think it is an exciting time in cancer research, primarily because of immune therapy and the promise that this has, and how much we're learning what we know and what we don't know. So we have identified a number of known unknowns about immune therapy, and the exciting thing about it is that cancers that were previously so heterogeneous that they could not be treated by any targeted therapy are now being targeted with immune therapy. So I think it's an exciting time. I think we have a lot more to promise our patients. But we are, still for the most part, this is at the cutting edge of cancer care. Many patients are still being treated with drugs that are 30, 40, 50 years old. And that's not where we need to be. So I think we still have a lot of work to do. Where the imaging fits into this is, like I said, images are data that can and should be used in the diagnosis and the individualization, the personalization. We talk about precision medicine all the time. Well, here's a huge piece of data that should and could be incorporated into the treatment decision models for individual patients. Where we are right now is conveying this message that I'm conveying right now, that images are data, and we can use these data in very meaningful ways to improve the care of individual patients. And where we're going with this is to make this a reality, to collect these large data sets, to build prognostic and predictive models, and then to get people to use them as biomarkers. So imaging provides very important biomarkers. And the thing that's most important about it is that these are routinely captured on every patient. So you don't have to do anything extra, right? It doesn't cost extra money. We just have to do a better job of analyzing them.